This is Cannaramic, and we're bringing you cannabis like you've never seen it before. Today, we are so excited to have Dr. Jeff Anderson, who is a researcher, scientist at the University of Utah, doing some exciting work on the brain and cannabis. Welcome, Dr. Anderson.
Thanks, Felicia. It's delighted to be here.
Well, I'm excited about your career. I mean, you have studied neuroscience, those words that make everybody else get creeped out, like neuroscience. That's what you've been doing all of your life. And you've studied the brain, and you're also an author who writes thrillers about the brain. So tell us a little bit, kind of, how did you get to where you are right now? You're about to do a study on brain disorders and cannabis. Kind of, how did you evolve from there to here?
Well, I went into neuroscience because of the challenge of studying the brain, and initially studied mathematics and then moved into neuroscience and medicine and ultimately into brain imaging. And what my laboratory does is tries to understand the organization of the brain, how its networks are put together, and how it can be abnormal in different conditions like developmental disorders or psychiatric disorders. And one of the opportunities for us to study cannabis is to understand exactly what happens in the brain when somebody's taking different types of cannabinoids. It's a pathway to help us understand how it might be useful for therapy.
This seems like a huge undertaking. I mean, the brain is one of those things that there's still not a full understanding of it. There's still a lot we don't know about the brain, right? And then
there's so much we do know.
It's
a great time to be a neuroscientist because there's so many new tools and opportunities for really learning things that we could never do before.
Okay, well, all those kids who are interested in being a neuroscientist, I'm going to direct them your way, because most folks are like, neuroscience, but yeah. You've got a great brain to do that. So you go ahead on that work. We'll just follow in your footsteps. So you're saying that there is a lot we know about the brain. There's a lot we can see about the brain. And now you want to add to it this kind of layer of cannabis, which is an area we don't know a lot about. Talk about why we don't know a lot about cannabis.
Yeah, so there's great research in cannabis, but mostly at the molecular level. Which receptors does it bind to? The kind of stuff that you can do in a test tube or in a laboratory. But what we don't know is in a living, behaving, working human being, what does cannabis really do to the brain? Which networks ultimately get excited or changed, or what's the mechanism by which we experience the effects of cannabis? And surprisingly, even with decades of research into cannabis, some of these really basic questions just haven't been answered. And there's a good reason for that. Most of the early research in cannabis was sponsored by the National Institute for Drug Abuse. And as the name implies, our perspective was, how can we prevent people from becoming addicted? And there's been a real sea change in the last 10 years where that's not the focus anymore. The focus is understanding, how can we use cannabis sensibly to help people?
So we've got this kind of gap in our understanding of cannabis. We know it from a basic level. Dr. Meshulam isolated THC and cannabinoids before, but we don't have the real nitty gritty. And you said that the focus has been on drug prevention. What about other research? What's stifling research in the cannabis, into cannabis?
Well, right now, really, it's a matter of regulation. So in order for my laboratory to study the effects of cannabis, it takes us about 1.5 to 2 years just to go through the regulatory process with the FDA, with the DEA, with suppliers, figuring out how to import products. And this is for even CBD, which has very little psychoactive and no addictive potential at all. And so for a compound that we see as incredibly safe, it's astonishing how much red tape, bureaucracy, how many barriers there are for a laboratory like mine to get involved. And that's why people haven't done it.
And a typical study of this kind would take how long? Like how difficult?
Up and running in 2 weeks. I mean, if I were, I mean, most of my research has been studying conditions like autism or Down syndrome or Williams syndrome. And if I have a new idea that I'm really excited about, I can get moving immediately. We have an institutional review board that reviews patient safety information, but that's it. We are able to very quickly move on new ideas. And when the federal government is involved the way it is in cannabis research, it changes the entire calculus, because then for me to start a new project, I need to have years of funding lined up just to test a very basic idea and get some pilot data.
Wow. And besides the funding, and this is because it's a Schedule 1 substance.
That's right.
Okay, so this work that's being done to deschedule it so that it's no longer in the same category as heroin and ecstasy, et cetera, is vital, not only for people to use it for medical cannabis, but also for researchers to be able to do the work.
Oh, absolutely. Yeah, we've had conversations with our congressman and senator, and I think still there isn't an appreciation in Congress how much research is being slowed down by federal bureaucracy. And I've heard them say that, well, there are mechanisms to go forward. And I don't know if they appreciate how many investigators are deterred from looking at questions involving cannabis just because of the time it takes to go through the regulatory process.
Right. So who's doing the research now? I know that there are drug companies that are coming out with products. Is that where most of the research is being done now?
No, there are so many investigators that are doing their own research that aren't sponsored by a pharmaceutical company. It's true that GW Pharma just got Epidiolex approved through the FDA, and there are some other compounds related to cannabis that have been approved by the FDA, but that's a tiny fraction of the research that's going on. There's a great deal of exciting new research into our own human endocannabinoid system, how we naturally process the same types of compounds that are in cannabinoids, as well as a wide range of animal studies, molecular studies, and starting to be more human trials and imaging studies.
And that's what you're doing. You're going to be doing human trials and imaging.
That's right.
It's the step up from doing animal trials, because animals don't operate the same way we do. Our brains are not the exact same. So you're studying brain disorders. Now, what is a brain disorder?
Well, it's some condition where there's an impairment in function or in behavior that's related to differences in the brain. And that can be everything from anxiety to serious conditions like schizophrenia or depression that may be very difficult to treat.
Mm-hmm. So things like ADHD, autism, you mentioned before, those are all in the category of brain disorders as well.
Yeah, well, there's actually a debate about whether what we call a disorder, what we call a difference. And there's an important movement related to neurodiversity. Are there people who could contribute so much to society if we removed some of the barriers for them to contribute? And some people with, for example, autism may not see what they have as a disorder. They see it as, in some cases, an asset. But there are much more severe cases too, where clearly when somebody doesn't have any functional language or can't communicate or function in society, then there's a case to look at it as a medical condition and a disorder as well.
I love the idea of neurodiversity. We won't go very much into that, but the idea that, some people have brains that are more inclined to do things a certain way, and the fact that those brains don't fall into the construct of our society, it's looked upon as, not normal, not, mainstream. So I love that conversation, but we can't talk about this today because we're talking about cannabis. So what is it about cannabis that kind of brought you to this idea that let's study cannabis in the context of brain disorders?
Well, one of the things that really got me excited about looking at cannabis is anxiety. I study autism, and the most difficult time that people with autism have is not related to symptoms of autism. It's related to anxiety. That's what really makes it so people have a difficult time holding down a job, becoming independent, and that anxiety. It's an absolute crisis right now, where so many people are being treated with drugs that don't work well. They result in massive weight gain, sedation, and it's not a, a healthy situation. And if there are opportunities for less toxic, more effective therapies for anxiety, well, I desperately want to help find those and study them and understand how they work.
So you saw cannabis and said, okay, this is a mechanism, this is the tool that could feasibly treat anxiety, because you saw anecdotal information about cannabis and anxiety?
That's right. There's some really exciting, promising early results that CBD in particular might be effective at helping with anxiety.
Well,
And that's worth testing.
yeah, I was going to say it's exciting because anxiety is something that, like you said, apart from the diagnosis of autism, like you said, it's not the autism that's the issue, it's the anxiety. Well, people have anxiety all the time, and it's not that they can't focus. It's the anxiety because they can't focus. It's the anxiety of the environment that causes the ADHD to be much more exacerbated. So kind of isolating anxiety and being able to find something that will help with that would really maybe make it so that these people can have powerful lives and be able to function. So that's exciting.
Yeah.
That's exciting. All right. So cannabis, CBD in particular, some early information stating that it can help with anxiety. So you kind of pair these things together and said, let's do a study and see how we can look at brain disorders and CBD and how these things work together. Now, how are you going to go about doing this? Because, the brain is a very complex thing. Well, for most people, I suppose for you, it's like people like me are like the brain. But how do you go about doing a study like this?
Well, we're using state-of-the-art brain imaging. So there are tools that we have for looking at how the brain functions that are really powerful. And in years past, brain imaging used to be about taking pictures of the brain, seeing is the brain too big or too small in some place or other, or is there a lesion in the brain? But we've moved way beyond that. Now we don't just take pictures of the brain, we take pictures of what the brain is doing. So we look at functional MRI, and in recent years we've moved well beyond functional MRI to things like functional connectivity, where we actually get a wiring diagram of an individual's brain, millions, tens of millions of connections in just a few minutes that we can measure, and measure quantitatively how strong is the connection between this region and this region. And we're able to actually get detailed architecture of the brain in a reasonable period of time. And that's what we want to look at, is how is that architecture dynamically changed in the presence of different cannabinoids.
Wow, that, like you said, there's so much. I didn't even know that could be done. I mean, you can actually get an architectural kind of framework, a wire diagram of a person's brain now with technology. Are most people's brains the same, or are there a lot of variations?
Surprisingly similar. There's so much that is in common between all of us, and that makes it easier to study because the differences are small but very important, and we know where to look, because the architecture for the brain for everyone is really quite similar. In fact, without using some of these powerful techniques, even people with severe brain disorders, people that have a very difficult time communicating, to the first approximation to I can't see a difference in their brain.
Wow. So it's these small things that are happening that are making the difference on the outside that we see. A lot of brain structure and everything is the same.
Yeah, and we can even go a step further. We can do molecular imaging to look at how the brain is affected in individuals by looking at certain receptors, for example, the CB1 receptor. And so we're we're planning on comparing what somebody's CB1 receptor concentrations are to how it affects attention and executive function,
Wow.
memory.
So the CB1 receptor is the one, the cannabinoid, the endocannabinoid receptor that is mostly found in the brain. Whereas for people to understand, the CB2 is found mostly in the immune system, right? So CB1 is where you see a lot of it in the brain. And you're saying you're going to be, well, you're able to compare, you want to look at the amount of receptors a person has based upon, you know, what kind of condition they have, and maybe be able to make some extrapolations from that.
Yeah, what we'd like to understand is, you know, cannabinoids don't work the same for everyone. People have very different dosages that they are affected by, and different effects. And for therapeutic implications, that's really important, because if we can predict who's going to do well with a certain cannabinoid and who's not, or predict which cannabinoids are going to be most effective for an individual, that's really important for therapy. So what we'd like to understand is, what is it that underlies these individual differences in how people respond?
Mm-hmm. So feasibly, a person that has a disorder like autism can have more receptors, CB1 receptors, than another person who has a different type of, maybe a more mainstream brain or another type of disorder. Is it the number of receptors, or is everybody's receptors?
Yeah, that's one of the factors. And we'd also like to know how people metabolize the cannabinoids. So their brain may be seeing a very different level just because of what happens in the gut. Or that may be related to other factors entirely. Some brain circuitry may just be more resistant to the effects, even if they have a similar number of receptors. So there's all these different factors that we want to test to really understand what is driving these differences.
Okay. So you've got 40, I think you said you have 40 subjects that you're planning to have for the study.
Yeah.
And all of these subjects are what we would call, I guess, mainstream, normal type of structure.
Yeah, they're healthy individuals.
What do we call them?
Just healthy
individuals. Healthy individuals. Yeah. So you will give these people dosages of CBD, and will it be
THC, and a combination of both.
Wow. So wait, you got a lot of variables. Now, I did my science project in school, and I'm also doing the ones with my kids. And I know that you kind of need the one control, right? Or something. And then you could introduce all of these variables. There's a lot of variables in here. How do you siphon out what's,
There's a few variables. We have to be really careful, because the study designs are complex, and it's true. If you introduce too many variables, if you're too ambitious, try to study too many things, you're left finding nothing.
Right.
Because it's too complex to tease apart. So we looked at the study design very carefully over many months to understand how we can best approach this.
Right. And I can imagine, I mean, you might be tempted to look at more stuff, but because there's so much to look at, but you gotta fine tune it and look at those variables, and also understanding the things like the gut metabolism. You mentioned that may impact the effects, as well as the structure, the wiring of a person's brain. So how do you find out what's considered a mainstream brain? Because even though the structures are the same, there's still so many things about us that are different, right? A person's diet will dictate, right, to some extent, what will be digested, how they'll take things. So that seems like such a challenge.
Yeah, well, what we do is we recruit individuals that meet specific criteria, and then there's so much about each individual that makes them unique, and we try and learn about the individuals and model those effects as best as we can. But certainly there's so many things that could influence the study, and we just have to do our level best to try and understand which of those variables are the most important.
Right.
But it's a first step.
It's a first step, because from here, you could feasibly get additional funding to be able to do a broader study, or someone else will take on the work that you've done and build on top of it. That's what science is all about, right?
This is becoming a big community. We need everyone with all of their talents. We need people that haven't been in the field of cannabis research, people that are world experts in their own niche, that have new tools people don't have, and be able to make a pathway for them to test cannabinoids with their own expertise, because that's when science really makes progress, is when we have different points of view and new ideas that all merge together to solve problems from different perspectives.
Is cannabis exciting now? It's certainly in the scientific community. I mean, it's certainly exciting in the consumer community. There's CBD everywhere and everything. How much does our consumer interest drive the scientific community's interest?
Some, but there's also a genuine scientific interest, and when there's as much misunderstanding as there is about cannabis in the community, that's a job for scientists to step into, because when there are people with wildly inaccurate information, both positive and negative, people who see, you know, great evil or harm in cannabis, and other people who think it can solve every medical problem, which is clearly false. We want to know what is true, and that's where scientists can really use the scientific method to make some headway towards answering the questions that are on people's minds.
Yeah.
If scientists aren't answering the questions that people care about, we're not doing our job.
Right. I mean, I can really see how this can affect the everyday person who is trying to, like you said, relieve anxiety. And they go to the store and there's all of these different products on the shelves and there's all of these different dosages. And, you know, just that's a whole nother animal, just the whole idea of the products that are being put out there.
Yeah.
You know, but really just practical information to tell them whether this works and how it works and what type of dosages they would need to really achieve effects.
Yeah.
That's practical information that everyone needs.
Yeah. Now, the other thing that people haven't understood is that there are many different compounds in cannabis that have different or even opposite effects. So whereas THC is great for nausea, and there might be counterproductive effects on something more like either PTSD or anxiety, where that might actually make the problem worse. And what you're really looking for is CBD for some of these indications. And that level of information, which cannabinoids affect which conditions, and whether in combination or by themselves, is just not out in the public sphere. And that's really fundamental.
Right. I mean, I was just talking with a medical marijuana doctor who treats tens of thousands of patients a year. He's got clinics all over Pennsylvania, and he talks about, you know, being able to prescribe, you know, cannabis or direct them to a particular strain. But you really can't, because you really don't know. All of this is kind of anecdotal, which strain and how much, you know, and the patients are, they have to become very educated and they have to be titrating up or titrating down, because you just don't have the exact information as to how to use it and what to use.
Yeah. And a patient may go to a dispensary and there might be some anecdotal information, but not solid placebo-controlled category 1 evidence. That's just not there. And then in addition to just CBD and THC, there are hundreds of other cannabinoids, terpenes, other compounds, and they interact with each other.
Right.
So there's so much left to learn about these potential therapies.
Right.
There's a lot more research that's
there is, and hopefully this will spur the scientific community. Now, are you using full spectrum or isolate in your research?
So we're using both. One of the things that we've seen in the research that we studied was that most of the limited research that's been performed in humans has been done in very purified isolates of a certain cannabinoid, for example, CBD or THC, and for good reason. That's how scientists work. We try to eliminate as many variables as we can. But then what people are doing is they're going into the community to try and seek treatments, and the compounds that they're taking are much more complex. And some people have theorized that that might be a good thing in some cases, that there's something called an entourage effect from having more of these different cannabinoids that can improve or potentiate therapeutic responses. And so we'd like to test that directly.
Mm-hmm. So you'll have at some point in time, you'll do the full spectrum, and then another point in time, you'll do the isolate or some variation of that.
That's right. Yeah.
So how does it work? You have your 40 suspects. They come in subjects. They're not suspects. They're suspects in your book, but not in the study. Okay. So you have these 40 subjects who come in, and you identify them. They come in, and what do you do to set the trial up? What kind of testing?
Yeah, so we have some laboratory tests where we measure blood levels of different cannabinoids. We have a number of different types of neuropsychological tests, just to understand everything from personality to how somebody processes attention and IQ, language, things like that. And then with that background information, we do imaging, and we have to be, very careful about making sure that we optimize our design, that the appropriate things are randomized. We'll have probably 7 different imaging sessions for each individual, in a combination of PET imaging and functional MRI.
Mm-hmm. So you get all these folks set up, and then from there, at what point do you start giving them the CBD, and how do you kind of go from that?
Yeah, we'll have an administration of a drug before each imaging session. Some of those will be placebo, and some of them will be either a CBD or THC, either full spectrum or isolate.
Okay, so they come in. Is it every week? Is it every month? Like how often?
Probably every couple of weeks for maybe 6 or 7 visits. We're asking a lot of our participants, and we hope that there are people in the community that are also sensing that this is an important question to answer, that are be willing to help us out with this.
Right. And you're doing this at the University of Utah. So this is going to be folks who are local who are going to be participating in this type of study.
Yeah, that's right.
All right. And when should we expect? So you're about to start, you're kind of in the preliminary stages. You've already got approvals.
We're knee deep in regulatory work. And so as soon as we finish that in some months from now, we'll be able to start imaging. And then I think we can move pretty quickly. We're really excited to get going.
Well, I am excited about your results. I'm excited that you're a neuroscientist. I've never met a person, and I didn't even know that people really were excited about this, but clearly you are, because you've written books about it. This is, I said to another scientist I spoke with that this is enlivened in me, my inner scientist. I didn't realize I like science. This is really good stuff. But what's most important is that it's really stuff that we need for the cannabis movement, for people to get help and healing. That's what they're looking for cannabis for. And you guys are going to help us to get the real hard science that's going to help people to treat themselves and doctors to treat them in the future. So we appreciate all you do. Thank you for being with us today. And thank you. I know that you have given us cannabis in a way we have never seen it before. I know people are going to get so much value from it. And we are looking forward to getting those study results in about a year, maybe.
Sounds about right.
Okay, we'll be on the lookout, and we'll be following up with you then. Thank you so much for all you do. Have a great one.
Thanks, Felicia.